Hello, I'm Liz, one of Derry's reference librarians, and welcome to another episode of Misinformation Busters. Once a week, we tackle a rumor or a false misunderstood story, and we try to separate fact from fiction. This week, we are talking about the Johnson & Johnson vaccine. So, what's the story? For the past few months, the Johnson & Johnson COVID-19 vaccine has been one of the 3 vaccines available to the American public. There are some differences. Pfizer and Moderna are mRNA vaccines and require 2 shots. J&J is an adenovirus vaccine and requires only 1. That's why it was the preferred shot for needle phobes. Then, on April 13th, the CDC and the FDA recommended a pause on the J&J vaccine, quote, out of an abundance of caution as 6 people developed rare blood clots within weeks of receiving the vaccine. So, what are the facts? Well, let's look at what's happening. The rare blood clots are known as cerebral venous sinus thrombosis, or CVST, which can occur when a clot forms in your brain and can result in a stroke. It's not great. It affects 5 in 1 million people each year. Doctors also saw a pattern as to who is reporting these symptoms. According to reports, the 6 women developed clots 6 to 13 days after they were vaccinated, and they were all between the ages of 18 and 48. Now let's look at the numbers. Out of almost 7 million Americans who have received the J&J vaccine, there are only 6 recorded cases of these blood clots. So if we're looking at it from a chance perspective, it's less than 1 in a million. And as my friend put in a completely unscientific but very funny way, there are more Air Bud movies than people currently affected with this rare blood clot. So, if the chance is small, why the pause? Well, this is about seeing if there's a connection. FDA Director Janet Woodcock said in an NPR interview that these clots were, quote, not very common, but more common than you would expect from people who never got the vaccine. So there seems possibly to be a link. Does this mean the vaccine is across the board unsafe? No, it is still effective against COVID-19. Unfortunately, this can happen in a new rollout. New side effects and potential dangers, depending on one's condition, can come up. I mean, it is not as if J&J did not hold trials and tests, but tens of thousands of people in a trial cannot account for every possible side effect. So they're looking into the vaccine to see what could be triggering a reaction or if the vaccine is even the cause at all. That's why they use the term abundance of caution. They have to consider everything. This is the CDC, FDA, medical professionals doing their due diligence to look at every possibility. Now, as for what's going to happen, we don't know. Dr. Fauci was on Meet the Press Sunday, and his prediction was that it was going to be resumed with additional warnings and guidance. It's actually similar to what happened in Europe with the AstraZeneca vaccine. There were issues with blood clots. They looked into them, found that there was a minor risk, and recommended that older patients be prioritized for the vaccine rather than younger people who seem to have more issues. But still, for this, we don't know yet, and we'll have to keep an eye on the news. At the end of the day, it's important to remember that the fact that this is being looked into is a good thing. Stephen Novella of Skeptic's Guide to the Universe podcast in Science-Based Medicine wrote that one of the takeaways should be that this shows our vaccine program is working, that we are catching even rare potential side effects. He also stressed that the blood clot itself is rare. Chances are you won't be affected. And all articles I've read said to look for signs like leg pain, headaches, trouble breathing. You might say, well, hey, that's all well and good to say, but it feels different when you've had the vaccine. There's a lot of uncertainty and anxiety. Well, I actually got the J&J vaccine recently, and let me tell you, Tuesday I had a good 5 to 6 hour run of being on the, oh, it's rare, I'll be fine train. Then my calf started to hurt, and I can't speak for everyone, but when you hear about these things, even the smallest little twinge in your body that's likely nothing suddenly becomes scary. The rational side of my brain knew that my calf pain was caused by extensive exercise and running, but there was that tiny little voice that told me, fiddle-dee-dee, this sounds like deep vein thrombosis. And before you know it, I was looking at the Mayo Clinic site. I mean, yes, I can fall victim to the what does the internet say thing as well. So, I stopped myself, I put the computer away, and I called my doctor. I said that I'd had the J&J shot, but I was pretty sure that my pain was likely caused by exercise, but I still wanted to know how to tell a minor problem from a major problem, because for me, leg pain's kind of a way of life. And to my doctor's credit, they had me actually come in so they could look at it and rule out the rare possibility that this was something bad. As they put it, they're so little known right now, they didn't want to chance it. And my rational brain was right. I just really had to stretch my calf more and ice it. I asked my doctor what to look for, and they gave me clear things beyond leg pain, headaches, and trouble breathing. They said that if it's in your leg, it's going to be red and swollen. But in the case of CVST, you're more likely to have debilitating headaches that no pain reliever can help, and you're going to have trouble breathing as if someone's sitting on your chest. So I don't know about you, but hearing that clearly described made me feel a little better and gave me more to look for in the coming weeks. And just wanted to say that it's okay to be nervous and anxious, but you have to remember where to look for accurate information and who to ask. It could save your life, or at the very least, save you a panic attack. Thank you for watching, and as always, check for our sources in the comments, or feel free to research using our EBSCO databases available through the library's website. Or when in doubt, ask a librarian or a medical professional. And I'll see you next week.